Good morning, everybody. My name is Emily Matthew. Welcome home. Today I will be talking to you about KW. Let me just. Okay. So, KW is a 14 months old First Nation little girl with a history of viral bronchiolitis and upper respiratory tract infection. She presents today with a cough of 5 days of duration. So her background. So she was born at 39 weeks of gestation via spontaneous vaginal delivery. She was hospitalized for bronchiolitis at 4 months old when she presented with desaturation, shortness of breath, rales, and retractions. She was again diagnosed with a bronchiolitis at 1 year old, but didn't need any hospitalization at that moment. She was mostly treated with nebulized salbutamol. Otherwise, she has had a minor upper respiratory tract infection at 10 months old and an otitis media once when she was 12 months old with her second episode of bronchiolitis. Her old cards. So 5 days ago, she started having a mild cough with rhinitis and a mild fever. She hasn't been producing any sputums. So the mother describes the cough as a wet cough that is worse at night or when she is laying down, and she noted that it's been improving after nasal suctioning. Since yesterday, she has had a gradual onset of wheezing and worsening cough, and it kept her up all night yesterday. Her associated symptoms. So she has shortness of breath since yesterday. She has had a mild fever for 5 days, and it has been more persistent since yesterday. She has anorexia for 2 days, but the mom says she's still drinking quite well. The mother reports she has been irritable for the past 5 days, and yesterday she's been resting all day, and she even refused to play with her siblings. The treatment's tried, so the mother started using a humidifier at night in her bedroom since she started having a cough. And she also gives her Tylenol when she has a fever. The last dose of Tylenol was an hour ago. So the predisposing factors. She has a history of multiple respiratory tract infections. She is a First Nation. They have poor ventilation in the house. They use a wood stove, and also the parents are smokers, although they smoke outside most of the time. Pertinent negatives. So to rule out TB, the patient hasn't had any contact with any positive TB cases in the past or recently. She has no night sweats, no weight loss, or no hemoptysis. Also to rule out asthma, she has no personal or family history of asthma, allergies, or atopic dermatitis. The patient has no congenital pulmonary or cardiac history, no congenital pulmonary or cardiac disease history. Evaluation of the problem to date. So it's her first consultation for this episode of cough. Medications. So she has no prescribed medication, and she doesn't take any inhaled medication as well. She received Tylenol an hour ago, which might mask fever at the moment. She has no known allergies. And then her past medical history. She has had a bronchiolitis at 4 and 12 months old, a URTI at 10 months old, an otitis media at 12 months old, and her immunization is up to date, including Prevnar 13. Her social history. So she lives with her 2 parents and her 3 siblings, and her older brother is also at the moment mildly sick with a URTI. Her father works as a carpenter, and her mom stays at home with the kids. They live in a First Nation community where the quality of the housing is often quite poor. So her focused physical exam. So her general appearance, she is alert and irritable. Her vital signs, her blood pressure is normal, 85/62. Her heart rate, she's a little bit tachycardiac, so her heart rate is 163. She's also a little bit tachypneic, so her respiratory rate is 50 per minute. She has a decreased pulse oximetry of 92% on room air, and her rectal temperature is 37.6. Then the relevant symptoms. So the main symptom that we want to assess, of course, is the respiratory system. Sorry. So in general, the patient has the pink coloration. you can hear audible wheezing. You can note that she has increased work of breathing with use of accessory muscles. You can note also that she has intercostal retractions and sternal notch. She doesn't have any nasal flaring, and at auscultation you can hear good air entry bilaterally with expiratory wheezings and a prolonged expiratory phase. You can also hear coarse crackles at bilateral lung bases. The patient has a regular breathing pattern, but she is tachypneic. She has also a symmetrical chest expansion at palpation, and at percussion it is normal with resonance throughout. HENT. So to start with the ears, so the patient's both tympanic membranes are red and bulging. They are not perforated and there is no drainage. You can tell that she has tenderness at palpation because when you pull the tragus on both sides bilaterally, she is crying. Her mouth, so she has a dry mouth mucosa, which might indicate that she is a little bit dehydrated. Her tonsils are not swollen, and didn't know there is no lesions in her mouth. Her eyes, so her sclera is white. She has also tears, which indicates that she is not too dehydrated. So her nose, so her nares are patent, but there is a lot of clear discharge. You can tell. You can see also. Sorry. She also has two soft and mobile tender cervical nodes, 0.5 by 0.5 centimeters on the left anterior cervical chain. Cardiovascular, so her cap refill is 2 seconds, and at cardiac auscultation you can hear S1 and S2. It's regular and there is no audible murmurs. Integuments, so she has a mildly persistent skin turgor and she has no skin rash. So, to summarize, KW. So she is a 14-month-old baby girl who has been having a URTI symptoms for 5 days, then followed by worsening cough and shortness of breath. She has wheezes, retractions, and coarse crackles, and also her TMs are red and bulging bilaterally. Thank you.